Good afternoon, class. I'm going to demo the Chaffee College way to insert intravenous IV catheter. First, as you know, I will check my orders to make sure it's appropriate for the patient as to why they're getting an intravenous catheter. I'm going to move past the point where I go and talk to the patient and notify them that they're going to get an intravenous catheter and to what reason. Ask them if they've had one before, maybe get preference as to what was the previous IV site or what's a good vein to use. For patients that are hard sticks, a lot of times they know, they could save you some time. So I'll explain to them the purpose, ask them if they have any questions. So they don't, they know, they're prepared. Assess anxiety level and then try to help to ease their mind, if you will. Then I would exit the room, gather my supplies. The supplies here, prior to selecting an appropriate IV site, would be the Tegaderm intravenous catheter, 14 gauge for a larger gauge catheter, larger vein, 20 gauge, it's pretty standard for adults, 22 gauge IV needle for smaller veins, maybe on the hand, or patients who may be a little dehydrated may have a smaller vein. And then we have the IV start kit that's already prepared, which will have my tourniquet, some gauze, tape. We'll have labeling as well, so we could label when we started the IV. This particular set is a ChloraPrep set, so it comes with sterile gloves. Although this is not a sterile technique, it's just a clean procedure. We won't need sterile gloves. And then also chlorhexidine prep. That is necessary if you're going to be drawing a blood culture. Alcohol prep will not be sufficient. You would actually need a chlorhexidine prep. Okay, and then we have extension tubing and saline flush. All of these I'm going to always check to make sure nothing's expired and the integrity of the package is intact for your checkoffs, okay? So now I enter the room with my supplies. I'm going to knock. Provide privacy and hygiene, of course. Hello, sir. This is, I'm back. I have the supplies. We're going to start your IV at this time. Before we do, please just identify yourself. Name, first name, last name, date of birth. Any allergies to medication? No. Okay, wonderful. First, I'm going to, we're going to raise the head of the bed so we'll save our back. This arm we're not going to use to start the IV for demo purposes. We're going to use the arm here. So I would elevate the head or the bed for the patient and save my back. If he's more comfortable sitting up, I could sit him up at that point. So hand hygiene, because we touched the bed again. We'll begin by preparing our supplies. Flush, prep our extension tubing. With saline, we'll leave it inside here. Always getting the practice of expelling the air. It's kind of tight. Shouldn't be that stiff.
Old.
Okay, there we go. Expelling the air. We'll connect. And at this point, I'm going to flush saline in our extension set here. You see it drip at the tip. We're flushed. No air in the line. I'm going to loosen that there. Okay. We have our tape, tourniquet. So what we're going to do before we even don gloves, we're just going to look for an appropriate site. Let me also prepare my Tegaderm. The reason why I like to do all this in advance is because once I find a good site and I'm confident in where I'm going to go, I want to get to it. I don't want a lot of time to lapse, because the longer you take to initiate the IV start, the more time the patient can get a little bit nervous or a little afraid. So being confident in what we're doing as to why we're doing it, It's helpful. We have limited space, so ideally the arm will be next to the patient and we will have more table space. Without gloves just yet, I'm going to go ahead and apply the tourniquet. 3 to 4 inches above the site. We're going to assume this patient is athletic. He has veins already visible. So we're going to go ahead and enter an IV on one of the forearm veins. So I'm going to apply, we'll say right at the elbow here. So nice and tight. So get some good tension on your tourniquet. Over the top, right hand over left, one finger underneath, goes underneath, and you have these little rabbit ears here, then pull a little bit and let go there. So that way your remaining tourniquet is dangling upward and not down into your site area. Let me demo that one more time. A lot of people tend to struggle with that. So be sure not to bunch this up tight like this. Keep it spread wide. So left, nice and tight, right over, one finger halfway through, just like so. Then you have a quick release. Well, I'll demo the quick release when we get ready. So now we're going to look for an IV site, and I need some alcohol preps. So we'll just pretend for now, for the sake of the video, this is an alcohol prep. Alcohol prep, okay? Clean the area, circle around, make sure you palpate, you feel like you have a good vein, a good place access. It feels a little spongy, meaning that you tap on the vein and you let up gently and you feel it fill back up with blood flow. That's how you know it's a good vein. You may see some nurses do this. They're trying to irritate the vein to get it to rise or plump, okay? Soft tap, no, maybe. Some people do 2 fingers, some maybe rub across gently to feel that IV site. When you're starting, I recommend you want to feel, palpate a vein, and see a vein. So Caucasian skin, the veins may be more green hue. African American skin, it may have a little bit more of a purplish tint, but ideally you want to see it and palpate. Okay, so that's our spot. We're going to identify that we're going to use his left forearm. That's where we're going to start our IV. You only want to keep the tourniquet on no more than, I believe, 2 to 3 minutes. So quick release tourniquet. This is discard our alcohol wipe. Hand hygiene. We already have our stuff prepped. A good vein, we're going to use our 20 gauge. So I'm going to go ahead and don gloves. Okay. Per hospital policy, some hospitals may require some type of transdermal numbing like a lidocaine at the site to ease the pain or discomfort for the patient. Check with your hospital. Maybe it's appropriate, maybe it's not. Most oftentimes, most nurses probably won't use it and just want to opt to poke the patient one time. So we're not going to do that. But if so, per checkoffs, you want to mention that as an option. We have our gloves on. We'll go ahead and prepare our 20 gauge catheter, needle here. And if you're educating the patient, you would let them know that you only use the needle to guide in a plastic catheter. A plastic straw is going to remain in the vein that will allow access to give medications, IV fluids, for rapid absorption into the body to help them heal, to get better. And you could also tell them that the idea is I'm going to look for the most appropriate vein to only have to poke them once. It's a good chance if you be, still and we get successful, one poke is all you need. But sometimes you may have to have multiple attempts to get a successful IV, and that's okay. Don't be discouraged. It happens to even the seasoned nurses. Okay, so now we're ready to start. So I'm going to go ahead and reapply the tourniquet. nice and tight. Allow the vein to feel as the tourniquet. You're stopping the flow of blood back to the heart so it could pool down into the vein and plump up, okay? In this case, since we have ChloraPrep, we'll do the ChloraPrep or alcohol wipe. If we were doing establishing a blood culture, we'll use the ChloraPrep. Squeeze down, get the juice, push down to see the chlorhexidine, and clean in a circular fashion. Clean your area, discard, okay? Allow it to air dry. I like to fold back my Tegaderm so I can one hand remove the top and be able to use it, because my left hand is going to be tamponading the vein so it won't continue to bleed. Okay, so expose my needle. Make sure that the bevel is up and the catheter is not. Sometimes when you take the needle out, the catheter could slip over the top of the needle like so. So you're going to make sure the catheter is flush to the top, to the bottom there. Bevel is up. And a lot of catheters, are really nice ones, have this little lever, if you will. So as you're advancing or threading the needle or the catheter into the vein, you have this lever where you use the one finger approach, okay? So bevel up, I see my vein. I'm just gonna move this to the side for now. And then try not to touch the area in which you're going to start a catheter. You want to 2 or 3 inches, press down and hold the skin tight. That helps to keep the vein still so it doesn't move side to side as you insert. Because if a patient is tense or the muscles tighten up, the vein could move a little bit. So ideally, you can kind of eyeball level or match up the angle at which your catheter needle is going to go. Tell the patient to relax. I like to get a good grip on the arm so that they don't jerk. So I will put my arm or my hand firmly around their forearm, use my thumb to keep the skin tight like so. I also like to hold the catheter in 2 fingers like so and allow a visual area here so I can see the blood fill into the catheter. So that way you'll know if you're in the vein or not. If you hold it tight, you can't see. A lot of times I notice students won't notice if they're in the vein because they won't be able to see the blood drip down into the catheter. So practice like so. Ever so gently, bevel up, grip the arm, skin tight with the thumb, and let the patient know you're gonna pull. Okay, so just try to relax. Some patients don't like the countdown. 1, 2, 3, poke. It's up to you, whatever you choose, or you don't have to say poke, but just 2, 3, on 3, 2, 3. 30 degrees, and turn the skin in. I felt the little skin pop. I noticed that my catheter, I could see blood filling in my catheter. At that point, I'm gonna level down 10 to 15 degrees. And at this point, what I've noticed is ask the patient to relax. Okay, I'm in the vein. Take a deep breath, relax. As they exhale, that is when I go a tad bit further with the needle in the catheter, and I exhale, and then I advance. This is a plastic. Our real arm would be really smooth to advance 1 finger like so. This one I have to sometimes, let me use 2 hands and advance the catheter nice and smooth. Needles remaining still. I'm advancing the catheter. When the catheter gets to the skin of the patient, that is when I'm going to tamponade the catheter so it stops bleeding, remove the needle. Nowadays in the hospitals, you have a safety. I would engage the safety on the needle, whether it's a button or a slide up safety engagement device. We'll say that we initiated the safety device. I got firm pressure with 2 fingers as I tamponade here, okay? I'm in the vein. I have my extension set. What I like to do is use my middle finger or ring finger to tamponade, use my pointer and my thumb to hold the catheter in place, screw on my extension set, quick release the tourniquet. I still have it in place. Extension sets tight. I first pull back to see blood return. I have blood return, nice, I'm in. Then I go ahead and flush smooth the remaining saline. As I'm flushing, I'm noting any discomfort? No. It's smooth, no resistance, no. I look at the skin, it's not beveling up, it's not cold, it's not bubbling, lets me know I'm in the vein. If it bubbles up at the site, if it's painful at the site, if the patient jerks, if it's resistance, you're not in the vein. You have to discard and start over, okay? So it's flushing smooth. At this point, I'll just double check. I like to double check, make sure I'm screwed in tight so it doesn't drip. Remember I was telling you one hand, I'm holding it steady because you don't want it to slide out. It's sensitive, you don't want it to pop out, especially if it's a child. One hand, discard. I have my Tegaderm. I like to leave in the window of the Tegaderm where the catheter meets the skin, the screw on, where the extension set screws on to the IV or to the catheter, and I will pinch down. That's where I begin to tape it down. Pinch down nice and tight, not to leave any air. Work my way around. As I even remove the outer portion of the Tegaderm, I walk it. So it's nice and tight seal, so that way you don't leave any area or portal of germs or bacteria to enter into the IV site. Nice and tight. Couple tricks of the trade to tape these down good, because you don't want to have to redo an IV of the patient. You want it to last. You could do another little piece of tape here. One of my favorites, I pretty much probably do on all my patients, I do a chevron. Especially, I think that's my pediatric background, chevron. So I'll take a tape, sticky part facing up, go underneath. Also too, as soon as you get flash and you flush, you want to go ahead and engage the what do you call it, the stopper or something. This is my chevron. So you can crisscross if you like. Want to tape that away, just to really tape it down. So that way, if they accidentally snag this or forget they have one, get up to go to the restroom, this bad boy is not going anywhere, okay? On the tip of this extension set, we should have an autoclave on here. So when you undo your flush, it will be a clave so nothing gets inside. But this one doesn't have a clave. But for demo purposes, at this point, we will undo the syringe. You'll have a clave. Bring the tubing back up like so. And we would also secure it a little bit more as well, just to keep it out of the way. We want the patient to be as comfortable as possible. I love the forearm site, not necessarily the AC, because every time they bend their elbow to use their phone or they're left-handed, right-handed, you could feel the IV there. If you do it on the forearm, they could move around, use their phone. A lot of times they forget it's there. It's all about patient comfort. I would tape down one more area here. Okay, so again, in real life, you would have a clave, you would have removed the saline flesh at this point. And that's the IV, sir, you did it. Great job. We'll gather up our belongings, make sure our sharps is in the sharp container, right? We'll just do that now since that one doesn't have a safety. Sharps container, gather up my supplies, okay? Take off my gloves. I can go ahead and use, there's one more sticker on here that you could label. You could initial, so you probably write on there first. Date, time, initial your name as the when you start the IV, because it's hard to write on the patient's skin. Maybe put it across here. Okay, so gather my belongings, lower the head of the bed, hand hygiene, return the patient back to a comfortable position, and say, okay, sir, that was it, you did great. And when you get back to the chart, you're gonna chart. You're gonna chart IV start, date, time, the size, 20 gauge needle, left forearm, and at this case, we would put prep with chlorhexidine, so if anybody else needs a blood culture, they'll know how the IV was inserted in a clean, not sterile, but with chlorhexidine prep, okay? And also how the patient tolerated it, and or how many attempts, 1 poke, 2 attempts, 3 attempts, whatever the case may be. My rule is 3 attempts. If I can't get it on the 3rd attempt, I'll have another nurse take a look and try to get it. Okay, so that concludes the IV video here. That concludes what's necessary to pass the Chafee checkoff or IV insertion. And also always reference Smith and Dools, Potter and Perry, and your Evolve video as well. Because there may be some tips on there that may be a little bit different from how I do it, but I thought that this would be most helpful. Okay, thank you much. Good luck.